fertility and medication and how medication can affect fertility, and things like that. So, as we spoke before, there are medications that also can not be safe for babies when the mother is pregnant. So, a lot of um, mothers may think that you need to stop all of your medications in order to have a healthy pregnancy for that baby. And that is just untrue. There are medications that you can be on to help control your disease, that will not affect the baby or pass the barrier and be passed on to the baby and affect them. So, again, that is a really big conversation to have with your own rheumatologist and gynecologist, and having a collaborative team. There are specific doctors, gynecologists that are for more high risk patients. So having a team of a high risk gynecologist and your personal rheumatologist that knows your story is really important to, continuing that on. I did mention again, that's talked a little bit more about, the medications to be safe. The medications to look for and all of that kind of stuff is more in the previous episodes and on mother to baby. So make sure, if you want to look specifically for your AI arthritis disease and the medications that are commonly used for that disease, and check it out and see which medications are deemed to be safe and which medications are deemed to be not safe and which medications are kind of in the middle of being studied. Make sure to check those resources out. Okay, so I wanted to talk about medications that can affect fertility. So the biggest red flag that I saw in all of the presentations was talking about cyclophosphamide. So with the medications having to do with fertility, there's one medication in particular that I saw over and over again that was deemed to really affect fertility in AiArthritis patients, is cyclophosphamide. And so cyclophosphamide, really depending on the dose, there's like a threshold of how high the dose would be in order to really cause infertility. And that can also depend on age. So if somebody is on cyclophosphamide and is needed to help control their disease, it's recommended that you preserve your sperm or egg. You would first have to go, maybe a few weeks or whatever it might take without the medication in order to have safe eggs and sperm to freeze. But that is something that is recommended. And then once, you freeze the sperm or the egg and go back on that medication for the time being until, if you're a woman, if you have to get pregnant. For males, you don't really have to worry about it anymore because the sperm is frozen. So that's a good thing. And so another set of medications that were studied were NSAIDs, are those pain medications that we might be taking, like naproxen, ibuprofen, and all of those different types of pain medication. And there's actually no significant data to state that ovulation and implantation is inhibited by NSAIDs. But there are certain situations where they have. So it's not significant data enough to say that for sure they do inhibit, and to tell people to get off of it if you're trying to get pregnant. But again, a conversation to have with your team of doctors in order to see what may be best for you. Another category that I wanted to talk about is ART, or assisted reproductive technology. We talked a little bit before when we were talking about freezing sperm or eggs, but there are all other options to be able to assist with getting pregnant and with conceiving. So a few of those different ARTs are meds to help females ovulate. There's IUI, or intrauterine implantation, or IVF, which is in vitro fertilization. So this is definitely recommended to do when your disease is well controlled. So that is the first step, is making sure that you can do all that you can to make sure that your disease is in the best state possible. Another thing to check for before doing any of these procedures would be to check for antiphospholipid antibodies, which can increase the risk of miscarriage. So just being making sure to do those precautions before doing these procedures, because as you may not know, it is extremely expensive to have some of these procedures done. So making sure that you plan and do all of these things to help the best success, um, is really important, to make sure that there isn't any money wasted or there isn't any time wasted and things like that. Another thing to note is that AI arthritis diseases can often cause longer times to get pregnant. So, for the average person, usually 12 after 12 months of actively trying to be pregnant and with no success, is considered the first step of infertility. And in AI arthritis diseases, it tends to take a bit longer. So maybe 18 months would be kind of considered the time where you start to get worried. But just knowing that with our diseases, it does take longer time to get pregnant. Um, the next thing to notice is, or the next thing to note is that embryo banking is actually the highest likelihood of success. So if there is someone that you know that you already want to have a baby with, whether you're a female or a male, you can connect with that person and see if there can be an embryo banking instead of just sperm or egg banking. So they have the highest likelihood of success, because there is no having to get them to be put together afterwards, after they were frozen. So that is something that is to look out for too. And as I stated before, it can be very, very expensive to have these done. But many employers are beginning to offer benefits to partially cover this. I've heard some stories about, someone working 20 hours at Starbucks a week for a few months in order just to get these benefits for fertility. There are a lot of different companies that do offer it to their employees. So seeing what you can do to get that for you, or if you already have those. And insurance coverage is on a state basis. There's only about 15 to 17 states that do require some kind of uh, insurance coverage for these types of procedures.